day that we have planning to have for so long, and so to see it come to fruition, to see all of you gathered here is really a great honor for us and an exciting moment for SQHK as a community.
I am a quality improvement champion in my department, and so I am so interested to work this journey with this team and see what other thing to bring on board so that we improve.
So right now we are in quality fever, getting everything in order. Yeah, but we trust that we'll get it because it's our culture. It's what we do, it's who we are. But other than that, in Gertrude's, I'm the chief pharmacist at the moment. So I've been there for the last 10 years or so. Yeah, so thank you. It's a pleasure to be here. I insisted on coming in person even with the rain.
Thank you.
Because I wanted to meet this lovely family and see how we can do more together.
Interesting thing in quality is documentation, and I'm more interested in statistics in quality and just building a quality culture across board. So I'm here to learn also from new ideas, network, and just grow this family.
I've been involved in quality for the last 3 or so years. So just before I used to just look at quality in terms of lab. We have the ISO standard 15189 for lab, but then you realize we cannot work alone, we need the other clinical departments. So then I got to learn about quality in other aspects. So it's amazing to have such kind of a forum, we get to share ideas, and I'm really happy to be here.
I believe the diversity in the skills and a lot of knowledge that we get in the different fields, when we are all working towards the best and one goal of quality of life, literally, should really be key.
There is no value without quality, so that's part of my journey. I have some of my mentors in the room, so I'm very happy to be here and to meet all of you, and hopefully we'll interact and see where we can make things better for the patients.
I have come to the realization that yes, there's quality, that we want healthcare quality for patients, but also I realized that I need to lean a little bit more into the quality of life for the people who then provide that quality of care. So I find myself in an interesting space where I'm looking at quality for patients, quality for healthcare providers. So I'm on a mission to humanize healthcare somehow. So yeah, I look forward to working with all of you.
I'm here representing the Africa Consortium for Quality Improvement Research in Frontline Healthcare. I'm one of the co-founders. We're about 3 years old, and we work across the sub-Saharan Africa context to support frontline healthcare workers in doing continuous quality improvement.
We support continuous quality improvement in most of hospital facilities. Also, we support supply chain improvement, that is from KEMSA side up to the last mile.
So I learned about this forum through Dr. Toy's LinkedIn, and they decided to come. Mekimak is relatively a young facility, about 3 years old now, and we are trying to put quality initiatives at the facility. But of course, we've got a lot of support from the main hospital, KNH, and the good news is that besides us being so young, we are still leaders in that in quality in Nyeri County. So I'm here to network with the stakeholders and get to learn much on the best practice in quality for the facilities.
This is a great day that we're able to be here, all with one interest on matters quality of care, healthcare quality and patient safety. Those are the big blocks. And as Esther has said, we are representing all the health sector. I've seen biomedical engineers, I've seen the clinical team having nurses, doctors, clinic officers, pharmacists, and various specialties.
I think when they were looking for people thinking around quality back in 2018, 19, I just happened to be walking by the KEMSA conversation. just walking by and you land a tender. Yes, so I think the affiliation to most of these people here is what drew me to get into those conversations with them, and so that's how I got into this quality conversation and working with the society, and now looking at the blend of how then do we drive quality and how can health financing speak and address quality of healthcare.
It is time for the family to grow wider. That's why we have called all of us here, because this is a Kenyan agenda, and because it matters that every other system is influenced by the saltiness that you carry, having that eyes and lens of affecting the quality of care, the quality whether at primary level or at policy level or at the level of facility. All those spheres require us in manufacturing of equipment, that we have biomedical people who support. So we have the healthcare professionals, but there's a special group called the patient representatives. So far we don't have an official link to some, but whenever we have conversations for our webinars, we try to get a few. So our hope is to have some formal engagement at some point, collaborations and partnerships, because there's nothing about us without us. So the patients have to be also represented.
My interest in quality began many years ago, having served as the initiating the quality department at Hurlingham Hospital some time back. I've also worked in the public health care space, donor-funded healthcare space, specifically on quality management and coordinating quality initiatives and capacity building for quality, something that I'm also very passionate about.
It came in 2018 when two members attended the SQHK 2018 Kuala Lumpur, and there was a very sound and solid organization called Malaysian Society for Quality Healthcare. And those two members brought like-minded people together. About 21 of them, they met at World Bank. We appreciate Dr. N.G.O, who was then at World Bank, through Frank Wafula, who is our Vice President. We were able to meet for almost a year, developed a constitution and had the registration. Then in 2020, we were officially registered by the Registrar of Societies as a non-political and non-profit professional organization. And so here we are. It is 4 years since we began. We will share the slides of what has occupied us that space, but the essence is that we need to break camp and have the Kenyan health system feel our contribution in a small way, but in a very important way.